Ankles are one of the most commonly injured body parts in sport, sprains being one of the most popular injuries. Along with this, sprains are considered to be at a high risk of re-injury due to the position of the body and how quickly they feel like they are back to normal. Some of the risk factors that are included in ankle sprains are previous injury and weakened muscles around the ankle, and this is what I have based my prehab session on. The first exercise we'll be doing is a single leg balance on a soft surface. I would normally use a Bose ball for this, but due to being at home, a pillow or towel can give a similar effect. This exercise will help engage all the muscles around your ankle and lower leg, helping to keep you upright. It will also be helping to increase the proprioception of the client as they'll be learning how to control their body in a different environment. This exercise we'll be doing for 3 sets of around 30 seconds on each foot, because even though even one ankle may have been previously injured, you want to keep the same level of strength and balance in both feet. You're able to regress this exercise to being on a hard surface if it is too difficult for the client, or progress it to having their eyes closed. Taking away one of their senses will really help improve proprioception. The next exercise is resisted plantar flexion and will be done for 3 sets of 10 to 8 reps. Here I'm using a resistance band to help with the exercise, but if you don't have one of these with you, you can use someone else at home to help resist the movement. Resting the lower leg on a surface allows for full range of motion during this exercise. This exercise will help with the strengthening of some of the muscles and ligaments around the ankle, including gastrocnemius. By keeping control of the resistance in the eccentric phase, you are also working on muscles such as the tibialis anterior and extensor hallucis anteriorum longus. To progress or regress this exercise, all you need to do is to increase or reduce the resistance being applied to the ankle. The third exercise is similar to the previous one, however, you'll be resisting against each version of the foot. I have included this exercise as lateral ankle sprains are the most common ankle sprains in sport. This exercise helps with strengthening of the peroneal longus and brevis, which are the main muscles involved with each version of the foot, and most likely the ones to be injured in a lateral ankle sprain. Again, with this exercise, we're doing 3 sets of 8 to 10 reps, with control on the eccentric phase, helping with the more medial muscles such as the tibialis anterior and posterior. Again, increasing and decreasing the amount of resistance will be how you can progress and regress this exercise. The final exercise is a balance and strengthening exercise for the lower body, including the muscles around the ankle. Starting in a position with your knees extended, you are moving up onto your toes. Once you've done this, moving down into a squat position while standing on your toes and keeping your back straight. Now you will slowly lower yourself down back onto your heels. From this position, you will return to the starting position by extending your knees back into the standing position. To help with this exercise, you can do it against a wall or with another person there to help support your balance. One of the things I like to do with my exercises is try to keep them sport specific to the client's needs. So, for example, if I had a American football player who had a previous ankle sprain, I would try to incorporate a throw and catch and drill with the ball into the single leg balance exercise, as long as they were competent enough in the first place. I would do this as it would try to keep them more engaged in the exercise themselves and adhere to the whole program as a whole. I have picked these exercises as the client I'm working with is not currently injured, and I would add them into their existing training program. I don't feel there is any need to make a specific training program for a prehabilitation of a lateral ankle sprain or ankle sprain, as it would take away the time the player has already training their skills for their specific sport.